In this video presented by Overpsyched, we are going to review Schizoid Personality Disorder. I'm Dr. Gerald Richardson, and let's begin with the objectives. We will first cover the diagnostic criteria, then explore some of the common features, followed by a brief comparison to other personality disorders. Then we will discuss the prevalence, development, and course, and conclude with the current understanding regarding treatment. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, defines schizoid personality disorder with the following diagnostic criteria. Criterion A, a pervasive pattern of detachment from social relationships and a restricted range of expression of emotions in interpersonal settings, beginning by early adulthood and present in a variety of contexts, as indicated by 4 or more of the following. 1. Neither desires nor enjoys close relationships, including being part of a family. 2. Almost always chooses solitary activities. 3. Has little, if any, interest in having sexual experiences with another person. 4. Takes pleasure in few, if any, activities. 5. Lacks close friends or confidants other than first-degree relatives. 6. Appears indifferent to the praise or criticism of others. 7. Shows emotional coldness, detachment, or flattened affectivity. Criterion B, does not occur exclusively during the course of schizophrenia, a bipolar disorder or depressive disorder with psychotic features, another psychotic disorder, or autism spectrum disorder, and is not attributable to the physiological effects of another medical condition. So now that we have the definition of schizoid personality disorder, let's explore some of the common features. These individuals appear to lack a desire for intimacy and often do not marry. They prefer spending time alone rather than being with others, and they're often described as loners. They tend to gravitate towards mechanical or abstract tasks such as computer games or math. These individuals often struggle with normal subtleties of social interaction. Sometimes they are described as living inside their own fantasy world. Individuals with schizoid personality disorder rarely have strong emotions such as anger or joy. They may struggle with expressing anger, even in very serious situations, which may cause others to perceive them as lacking emotion. Others may think their lives appear directionless and that they lack goals. Winnicott said that individuals with schizoid personality disorder prefer to make relationships on their own terms and not in terms of the impulses of other people. Alexithymia is often present. This is the inability to identify and describe emotions. Now let's briefly compare schizoid personality disorder to some of the other personality disorders. Due to their lack of interest on other people's opinions, individuals with schizoid personality disorder may appear to have a sense of superiority or grandiosity. However, this is very different from the features observed in narcissistic personality disorder or histrionic personality disorder, where those individuals tend to seek the approval or attention of others. And also, the term schizoid sounds very similar to schizotypal, and both personality disorders are in cluster A. Now, both personality disorders have detailed descriptions in the DSM, but in general, you can summarize the two to distinguish them from each other with the following. Schizoid personality disorder, these individuals are happy being alone. Schizotypal personality disorder, these individuals have magical thinking. And of course, you can watch our next video on schizotypal personality disorder for the full details regarding that diagnosis. Now let's discuss schizoid fantasy. This is not to be confused with the magical thinking that's observed in schizotypal personality disorder. Fantasy is a common defense mechanism employed in schizoid personality disorder. Fantasy is a relationship with the world and others by proxy. It is a surrogate or substitute relationship that is free from the dangers and anxieties associated with relationships with real individuals or situations. With fantasy, individuals with schizoid personality disorder may be able to experience attachment and feel connected, but still be free. There are many types of defense mechanisms, but fantasy is a common one seen in the cluster A personality disorders, especially in schizoid personality disorder. Next, we're going to cover the prevalence, development, and course. The exact cause of schizoid personality disorder is uncertain, but there are some links with schizophrenia. It's thought to be part of the schizophrenic spectrum of disorders, which also includes schizotypal and paranoid personality disorders, the cluster A personality disorders. And some twin studies suggest that there are inheritable traits, so there may be a genetic factor as well. Depending on the study, the estimated prevalence ranges from less than 1% to 4.9%. It is more commonly diagnosed in males, and often individuals may meet criteria for an additional personality disorder, including avoidant, schizotypal, or paranoid. Schizoid personality disorder typically appears in childhood and adolescence, and poor peer relationships is a common first sign of this personality disorder. Schizoid personality disorder is linked to a reduced quality of life and increased risk of bullying, which may also be an early sign in childhood or adolescence. The isolation and emotional detachment observed in schizoid are also general risk factors for suicide. However, some studies suggest they are not likely to attempt it. And since it is a personality disorder, schizoid personality disorder is typically chronic and long-lasting and is not expected to improve significantly without treatment. And before transitioning into the treatment, let's first discuss some of the subtypes. Now, these subtypes are not described in the DSM, but Theodore Millen described a few subtypes that you may encounter. First is languid schizoid. This is characterized by marked inertia, low energy, lethargic, or exhausted. Then there is remote schizoid. This is distant and removed, aimlessly drifting or secluded. Then there is depersonalized schizoid, where the body and mind are disjoined. And finally is affectless schizoid, or passionless, unresponsive, or uncaring. And as a side note, Theodore Millen's work helped better define schizoid from schizotypal and avoidant personality disorders. So now let's discuss how to treat schizoid personality disorder. The effectiveness of psychotherapy and psychopharmacology has not yet been extensively investigated. A limiting factor is that individuals with schizoid personality disorder who are happy being on their own rarely seek treatment. A common feature for many personality disorders is that these are egocentric, and they don't necessarily view their symptoms as being a problem. In the past, atypical antipsychotics were considered, but this is no longer recommended. In general, medications aren't typically used to treat schizoid personality disorder. They're usually only most useful when there is a comorbid condition like major depressive disorder. Therapy may be more effective, but people with schizoid personality disorder often struggle with certain modalities, such as cognitive behavioral therapy, due to difficulty forming a good working relationship with the therapist. And finally, socialization groups and educational strategies that help individuals identify their positive and negative emotions may be helpful. This concludes our discussion on schizoid personality disorder. Thank you for watching, and be sure to check out overpsyched.com for more resources.